Hello dear students, today's topic is sulfonamides and co-trimoxazole. Let us start. Sulfonamides. Sulfonamides are the derivatives of sulfanilamide. These are the first antimicrobial agents which were found to be effective against the pyrogenic bacterial infections. Frontosil red was the dye which was used by Domack, and it was found to be effective against streptococcal infections in mice in 1937, and after that the drugs were used regularly for the treatment of various infectious agents. These drugs are called as sulfonamides. Sulfonamides can be classified according to their action or duration of action. First class is short acting sulfonamides, for example sulfadiazine. Intermediate acting sulfonamides which shows action for up to 8 to 12 hours, example is sulfamethoxazole. Long acting sulfonamides which may produce action for up to 7 days, like sulfadoxine, sulfamethopirazine. And there are some special purpose sulfonamides like mefenide, silver sulfadiazine are also available. So this is the classification of sulfonamides. Sulfonamide drugs produce their action by acting on the starting material for the synthesis of purines and pyrimidines. Let us see its mechanism of action. So folic acid is very essential for the growth of many bacteria, as it is crucial for the nucleic acid synthesis. Many bacteria need folic acid for their growth. Sulfonamides are the synthetic bacteriostatic agents that inhibit the bacterial growth by interfering with this folic acid synthesis. Now, how sulfonamides inhibit the synthesis of folic acid? So, sulfonamides are structurally similar to para-aminobenzoic acid or PABA, which is the starting material for the synthesis of folic acid. Since they are structurally similar to that of para-aminobenzoic acid, the synthesis of folic acid is inhibited. The para-aminobenzoic acid is converted into dihydrofolic acid with the help of dihydroterate enzyme, synthase enzyme. This dihydrofolic acid is further converted into tetrahydrofolic acid with the help of enzyme called dihydrofolate reductase. This tetrahydrofolic acid is utilized for the synthesis of purines and essential nucleic acids, that is DNA or RNA. And this is how the bacterial growth occurs. Sulfonamides compete with this para-aminobenzoic acid, thereby inhibit the activity of dihydroterate synthase enzyme, because of which the formation or synthesis of tetrahydrofolic acid is inhibited. So in this way, these drugs blocks the production of dihydrofolic acid. This action prevents the bacteria from producing essential nucleic acids. So in this way, sulfonamides act as bacteriostatic agents. The antibacterial spectrum of sulfonamides. Sulfonamides are broad spectrum antibacterial agents that are primarily bacteriostatics, meaning they inhibit the growth of bacteria rather than directly killing them. Their spectrum covers a wide variety of gram-positive as well as gram-negative bacteria, and it also affects some non-bacterial pathogens. Now, sulfonamides affect some gram-positive bacteria like Staphylococcus aureus, Streptococcus pyogenes, and Actinomyces species also. While gram-negative bacteria includes many respiratory, urinary and enteric pathogens such as Haemophilus influenzae, Neisseria meningitidis, E. coli, Shigella, Salmonella and many more. So since sulfonamides are effective against gram-positive as well as gram-negative bacteria, so we call it as broad spectrum antibacterial agent, which shows bacteriostatic effect, means they inhibit the growth of bacteria, they does not kill the bacteria directly. So since it is a it has a broad spectrum of activity, so there are multiple uses. Like they can be used in the treatment of various urinary tract infections or called UTIs. Like the most common use today, often employing highly soluble sulfa drugs like sulfoxazole or sulfamethoxazole. They are also indicated in respiratory infections like bronchitis or otitis media, ear infections, and some pneumonia. Again, they are indicated in severe burns. Their topical applications like silver sulfadiazine or mefenide are used to prevent the infections in burn patients, and some other infections includes pneumocystis, pneumonia, leprosy, and malaria. So these are the therapeutic indications for sulfonamides. Let us discuss the adverse effects of sulfonamides. So common side effects includes dose related, which occurs in roughly 2 to 5% of the patients. The common side effects includes gastrointestinal side effects like nausea, vomiting, and diarrhea, while central nervous system side effects includes dizziness, fatigue, insomnia, and in some patients there is loss of appetite and painful or swollen tongue. Apart from these common side effects, there are some hypersensitivity reactions produced by sulfonamides. The mild hypersensitivity reactions includes itching, hives, and generalized skin rashes, while some photosensitivity reactions have also been reported by the sulfonamides. Photosensitivity means increased sensitivity to the sunlight, which can lead to severe sunburn or blisters on the skin. So these are the adverse effects of sulfonamides. Now second topic of this video is co-trimoxazole. Co-trimoxazole is the fixed dose combination of sulfamethoxazole and trimethoprim in the ratio of 5:1. The trimethoprim is diaminopyrimidine related to anti-malarial drug pyrimethamine, which selectively inhibits the bacterial dihydrofolate reductase. Thus, the human folate metabolism is not interfered at antibacterial concentrations of trimethoprim. Individually, both these drugs, that is sulfamethoxazole and trimethoprim, are bacteriostatic agents, but in the combination they produce bactericidal effect against many microorganisms. The purpose of using combination of these two drugs is to decrease the development of bacterial resistance and to achieve synergistic effect. This combination is particularly used for the urinary tract infections along with the treatment of many gram-positive and gram-negative infections. Let us discuss its mechanism of action. So as we have already discussed that many bacteria required para-aminobenzoic acid for the synthesis of tetrahydrofolic acid and folic acid, which is further required for the synthesis of purines and DNA synthesis. So PABA is converted into dihydrofolic acid with the help of enzyme called synthetase. Then it is reduced to tetrahydrofolic acid with the help of enzyme dihydrofolate reductase, and then it is converted into purine and then DNA. So both these drugs act on this pathway. Sulfonamides inhibit the conversion of PABA to dihydrofolic acid by inhibiting the activity of dihydrofolate synthase, while trimethoprim inhibit the conversion of dihydrofolic acid to tetrahydrofolic acid by inhibiting the enzyme called dihydrofolate reductase. So by inhibiting both these enzymes, that is synthase and reductase, these drugs inhibit the DNA synthesis and inhibit the growth of bacteria. So they produce synergistic effect when used in combination. So they can be used in the treatment of various urinary tract infections, respiratory tract infections, and diseases like typhoid, bacterial diarrhea, dysentery, pneumocystis, and chancroid. So this is all about sulfonamides and co-trimoxazole. In next lecture, we will discuss about some other drugs in chemotherapy. Thank you.